Hello, my name is Bonnie Watkins. I am a nurse with PPR. I'm currently a traveling nurse. I've had my nursing degree since May of 2000, waited until I had my children raised before I followed my own career. I enjoy nursing. It's something that I had always wanted to do. It's been a pleasure for me, and it's an opportunity to meet and greet new people. I started in medical surgical. I worked in my hometown for a year and a half before I began my traveling career, and I've just learned so many things traveling. I've met so many people, learned different ways to do things. I've discovered that nursing is not about skills. It's not about passing medications. It's not about a specific disease process, but nursing is an overall experience that you have with another person. You are able to make a difference in that person's life and the life of their family. It's something that not just one person can do on their own, but it takes a team effort. Without the help of the other staff, without the help of the nursing assistants, without the help of the people who answer the phones, the call bells, the physical therapists, the occupational therapists, the dietitians, it's totally a complete family-oriented experience, on both the patient end and on the nurse's end. Everybody must pull together and able to get the best care for any patient. And it's such a rewarding experience. It's a field that not just anyone enjoys doing. And for me, nursing is such an enjoyment. I am able to meet so many new people. Because I'm a traveling nurse, I've been through Florida, I've been to Kentucky, I've been different places, and I just totally love the different cultures, the different ways and opportunities to do different things. I learn something new from each person that I meet, not just each place that I go, but each person that I meet. I learn a different attitude. I learn a different perspective from that person's eyes. I have had a lot of experience in orthopedics and neurology, and I love to see the people come in with something broke that can be fixed, and then you send them on their way. You know that they're going to experience a higher quality of life because you have been able to aid in repairing a broken part of them, and in doing so, you've also been able to experience part of what goes on inside of them emotionally, what's going on in their head, how they feel about life, and the things that they have experienced in their life. It's such a rewarding field that I just couldn't imagine doing anything else. It gets me just real emotional. I spend a lot of time with my patients. For me, charting is the last thing that needs to be done, or to do as you can. But it's patient care. It's sitting down with them. It's talking to them. It's finding out so many things about them that affect not just the disease process that's going on with them, but their very well-being, the inner part. It's encouraging when they're discouraged, and when there's no family around, when you have older people that don't have family nearby. You're that family for them. For younger people that are not able to be with their parents, or that are not quite sure that they're ready to take their wings and fly, it's being there and encouraging them. It's just, there's so much more to nursing than giving a shot or giving them some type of medication. And for people that don't understand it, whenever I train someone, I always tell them it's not about skills. You can teach anybody to do anything. It's about the whole encompass of it, being able to be there for those people, to pray with them, to talk to them, to encourage them when they're discouraged, to explain things that they don't understand. And when you don't know the answer, go find somebody that knows the answer. Find out the way, because that's what they're looking to you for. They need to know information, telling them that they can do it. It's just so, and then you see them walk out. You see them encouraged by what you've done. You are the person that talks to the doctors, that gives them the information that they need in order to make accurate healthcare decisions for this patient. You are truly a patient advocate, and there's just, it's so rewarding that I can't in just a few minutes explain how it has affected me and how dear it is to my heart. I have been both a patient, I've had family that are patients, and it's so awesome. The whole scope of nursing practice is such an awesome opportunity for people to learn and be with those that need somebody with them. You're the Florence Nightingale in the middle of the night. You're the person that they can talk to when they can't talk to anybody else. And they know that when they talk to you about things, that you're not going to be their meddling neighbor and tell the whole neighborhood. They know that everything that they tell you is safe with you. And it's just so much more than a simple disease process. It is a whole scope of being. And you work together to be able to rely on the other staff, to be able to know that you can walk out of a room and you have somebody there that understands what you're going through and that's willing to help you in whatever need that you may have, whether it is to help you with passing medications or to say, hey, you did a good job. It's a family thing. And I travel, I've seen so many people, I've met so many different cultures, even from one city to the next. And to be able to encompass all of those things and take it to each position that I go into, I am truly blessed. And I am so thankful that I was able to secure my degree in nursing. And I look so forward to each and every day that I'm able to go in and meet and talk with the people and try to make a difference in their lives and allow them to make a difference in mine, as each and every one of them does. Thank you.